Good day, everyone. I'm Maria Jessica Fabroa, and today I am going to talk about the pulmonary edema. So, the content of this presentation includes the definition of the disease, the pathogenesis, the signs and symptoms, the treatment and medical management, the diagnostic and laboratory procedures, the nursing diagnosis, and its management. So, what is pulmonary edema? By definition, pulmonary edema is defined as an abnormal accumulation of fluid in the lung tissue, the alveolar space, or it can be both. It is simply defined as fluid in your lungs. This can be a severe or life-threatening condition if it is not treated immediately. Pulmonary edema is classified into two types. The first is the cardiogenic pulmonary edema. It occurs when the heart is unable to pump out the normal blood volume from the lungs due to a dysfunction in the left ventricle. And the next is the non-cardiogenic pulmonary edema. It occurs when there is no left ventricular dysfunction despite a fluid accumulation in the lungs or not caused by any heart problems. So the causes in the cardiogenic pulmonary edema includes congestive heart failure, coronary artery disease, cardiomyopathy, heart valve problems, and hypertension, while in the non-cardiogenic pulmonary edema is near drowning, high altitude, and physical exertion. So the pathogenesis of this disease. First, let's talk about the pulmonary circulation. The blood from the lower part of the body enters through the inferior vena cava, while the blood in the head and the upper parts of the body enters through superior vena cava. These two large valves will lead to the right atrium. Upon entering in the right atrium, the blood will go to the tricuspid valve, and then it will lead to the right ventricle. So the right ventricle contracts and pushes the blood to the pulmonary valve. Upon entering the pulmonary valve, it will lead to the artery. So this artery leads the blood to the lungs. So in the lungs, the gas exchange happens, carbon dioxide in exchange of oxygen. Upon this process, the oxygen will enter, or the blood will enter through the pulmonary vein. And then it will lead to the left atrium and enters the blood in the mitral valve, or also known as the Becquerel valve. Then it will lead to the left ventricle. So what happens in the pulmonary edema? It can develop slowly, especially when it is caused by non-cardiac disorders such as kidney injury and other conditions that causes volume overload. So this volume overload causes the pressure to build up in the left atrium, which the left ventricle will not handle that blood volume and pressure buildup in the left atrium. So there would be rapid increase in arterial pressure, which results in an acute increase in pulmonary venous pressure, which produces an increase in hydrostatic pressure that forces the fluid out of the pulmonary capillaries, and it will go to the interstitial spaces and the alveoli. So the fluid within the alveoli mixes with air, producing the classic sign of pulmonary edema, which is the frothy thinks blood, or blood stinks sputum. So the large amount of alveolar fluid create a diffusion block that severely impairs gas exchange, which results to hypoxemia. The signs and symptoms of the disease: decreased cerebral oxygenation, tachypnic with noisy breathing, incessant coughing, sense of suffocation, sudden onset of breathlessness, anxious, tachycardia, hands are cool and moist, cyanotic or pale skin and mucous membrane, and jugular vein distension. Nursing diagnosis is impaired gas exchange related to low oxygen level secondary to pulmonary edema. The nursing interventions are assessing patients' lungs for areas of decreased ventilation and auscultate presence of adventitious sounds. observe for nail beds, cyanosis in skin, especially note color of tongue and oral mucous membrane, and assess for headaches, dizziness, lethargy, reduced ability to follow instruction, disorientation, and coma. And monitor oxygen saturation continuously using pulse oximeter. Next diagnosis is an effective breathing pattern related to pulmonary edema. The interventions are assess patient's airway and breathing pattern, assess respiratory rate, depth, and effort including the use of accessory muscles, nasal flaring, and abnormal breathing patterns, and also position the patient upright, preferably with legs dangling over the side of the bed. Next diagnosis is fear and anxiety related to death. So the interventions include reassuring the patient and providing skillful anticipatory nursing care, must remain with the patient, and gives the patient simple, concise information in a reassuring voice about what is being done to treat the condition and the expected results. These are the management. Medical management includes the use of diuretics in order to promote the excretion of sodium and water by the kidneys. Example of this is furosemide or another loop diuretic given by IV push or as a continuous infusion to produce a rapid diuretic effect. Next is the vasodilators such as IV nitroglycerin or nitroprusside to enhance symptom relief in pulmonary edema. Next is the treatment modalities, the endotracheal intubation and the oxygen therapy. So oxygen is given in concentrations adequate to relieve hypoxemia and dyspnea. Last is diagnostic or laboratory procedure, the arterial blood gas, pulse oximetry, electrolytes, bond, and creatinine. Also includes chest X-ray. So if pulmonary edema is not treated immediately, it can lead to complications like edema of the lower abdominal cavity, pleural effusion, liver congestion, and swelling. Prognosis of the patient is good if there would be prompt intervention preventing further complication. That would be all. Thank you for watching.